We're now going to move into the brachialis muscle, which we know is a muscle that lies deep to the biceps muscle. And just to review its origin and insertion, it starts on the anterior distal half of the humerus, and then it runs down to the ulnar tuberosity. So its main action is just flexion at the elbow. And this is anatomical position. We're now going to bring up into test position, where in this case we're actually going to rotate into pronation. And what this does is it prevents too much activity in the biceps muscle, because we know that's a supinator. So if we turn the wrist into pronation, this is a good test position to really check that brachialis muscle. And the force is going to be down with my hand, and he's slowly going to resist as I load in, hold there nice and strong. Notice how the biceps muscle still puffs up a little bit, because the brachialis lying deep to it, when it contracts, you actually get a lot of push forward, which can help accentuate the biceps muscle anytime you're doing a pose. So this would be the easiest way to isolate that muscle. Again, you're still getting some activity from all the other elbow flexors, and that's okay. This is just a really good way to isolate that one. So to further illustrate how the brachialis contracts underneath the biceps, let's bring them up into a nice flex position here. Now you can see very clearly the biceps heads here, both of them, as well as the brachialis lying deep to it all through here. And the contraction of all that is what lifts the muscle up and gives this nice double peak here. To best isolate the brachialis muscle in a supine position, we're going to flex the elbow to 90 degrees, move the wrist into full pronation, support at the elbow, and then again I'm pulling down the table while he slowly builds resistance and resists me there, and then slowly load out. And if you want to palpate while you do this, you can slide off laterally off the biceps, push into the tissue deep, and then as I slowly do a muscle test, I can feel that muscle contract directly below my thumb. So if we ever needed to do any soft tissue work, this is how you're going to approach and get specific on that brachialis muscle.